I guess the other thing that fires me is that, over time, your work, what your job description is different, the industry can be different, the job description is different. The thing that never changes is a sense of community that you can either choose to bring to the party or not. And you can choose to build an environment. You have your neighborhood with your family, you have your neighborhood that you live in, your family community, you have your church community. Work is a community. So you can either build it into something that is fun and respectful and people have a place at the table and feel valued, or if you don't pay attention to it, it doesn't end up like that. So put some effort into thinking about what sort of community do you want. That's not just me or any individual. What sort of community do you want to build?
I am here with Alex Morehouse, who's the Chief Marketing Officer of Banner Health.
I started out, I thought I was going into marketing being a sort of on the creative and branding side, and I ended up on the digital side. And my title, most of my counterparts now have the title of Chief Digital Officer because I'm doing all the digital plumbing. And what ended up happening was that financial services, I spent most of my time, the first part of my career in financial services, which uses federally protected data, so a lot of privacy regs are in place. But then when financial services melted down, it was also, not coincidentally, when the Affordable Care Act went through and all of healthcare had to really pivot. Healthcare is about 20 years behind every other industry, airlines, retail, banking. And so I was recruited into Kaiser because they had to put all the plumbing in place to be ready for when the Affordable Care Act went live. And then Banner recruited me. I had never heard of Banner. Most of healthcare in this country is very regional. So there's usually a dominant player that's 3 or 4 states. We are in 6 states, but it's if you haven't been in the Southwest, you wouldn't have heard of Banner. But it's big. It's 12 billion. It's 60,000 employees. We have 500 retail locations and 40 hospitals, and it's a big player. But it also had most healthcare systems grow through acquisition. They acquire urgent care, they acquire a prescription business, they acquire PT and rehab, and none of those things talk together on the back end. So again, I was hired, it's not very glamorous, but I'm the master plumber. So I had to make all those systems talk to each other. And so I spent the past 5 years putting together our digital transformation was putting together a digital platform so that all of us who experience frustration with why do I, clipboard of doom, why am I filling out my history yet again? It's the same system. Why is, my Banner pediatrician asking, the exact same questions of my kid over here as they are in urgent care? I already told you that. So trying to make the back end systems talk to each other has been what I've been doing. Only hire people who are way smarter than you are and then get out of their way. Support them and get out of their way. To this day, my team, it's like every single one of them is so far ahead of me, but just get out of their way. Hire really good people, keep them happy, and get out of their way. I think a piece of advice is simply, first of all, ask for mentorship, because I'm only where I am because I had very generous people who basically helped me out when I said, hey, can you help me out? I don't know what I'm doing here. So don't be afraid to make mistakes. And also get in past your comfort zone, because when I took that, I still remember my first day at Epsilon, which was a subsidiary of American Express. And I've been working on membership has its privileges and these gorgeous McCann Erickson photo shoots. My first day on the job, they handed me a 4-ring binder like this. It was a data dictionary. And I thought, oh my God, I've landed in hell. I have no idea what I'm doing here. But if you learn where the data is inside your company, you know everything. You have the keys to the kingdom. Well, probably the one at Banner. So when we launched on our digital front door, I thought, oh, this is familiar, right? Because there's a recipe for how you did it. And I had done it at so many companies before. I thought, okay, so I'm just going to take what I learned in banking and drag it over here. And certainly the technology piece is what you have to do to land the data and scrub it and structure it is not that different. But the part that I completely underestimated is the change management. If you're moving the cheese of physicians who are fabulously overworked and have so much change coming to them and so much paperwork that they have to put through, and if you're also moving the cheese for patients who are used to picking up the phone to schedule an appointment, instead you're giving them this open table, like, you're going to do it over here. So I stubbed my toe early on and then quickly course corrected, and then, had an expert panel of physicians who helped guide all that. But it's very easy when you're doing these large scale digital transformations to think, oh, it's just a stack of technologies. Actually, tens of thousands of people's lives. It's your employees. It's all these people who are coming to your website, to your call center, to your retail locations, to your clinic. So take that very seriously and pay attention. You don't have to guess. They're telling you all the time through their actions. It might not be through their words, but they're telling you through their actions if you've gotten it right or you've made it too difficult. So baseline is be kind. If you can't be kind, get out. I want nothing to do with you. Be kind and be generous, and be generous with your spirit, because there's too few of us and too much work to do. And unless you can be generous with one another and with your skills, it just won't work. It's not a value judgment. It's just not going to work here. And I think the other is high challenge and high support. So my style is, okay, so there's this big thing we're going to have to do, but you have 100% of support. If someone falls down, I will take the heat. And likewise, you need to do that for your team. So provide high challenge and high support for them. So create an environment where people can be their best and where they can fail.